Question 1. An ambulatory care nurse is discussing preoperative procedures with a Japanese-American client who is scheduled for surgery the following week. During the discussion, the client continually smiles and nods the head. The nurse interprets this nonverbal behavior as A. Reflecting a cultural value. B. An acceptance of the treatment. C. The client is agreeable to the required procedures. D. The client understands the preoperative procedures. Correct answer. A. Nodding or smiling by a Japanese-American client may reflect only the cultural value of interpersonal harmony. This nonverbal behavior may not be an indication of agreement with the speaker, an acceptance of the treatment, or an understanding of the procedure. Question 2. When communicating with a client who speaks a different language, the best practice for a nurse is to A. Speak loudly and slowly. B. Stand close to the client and speak loudly. C. Arrange for an interpreter when communicating with the client. And D. Speak to the client and family together to increase the chances that the topic will be understood. Correct answer. C. Arranging for an interpreter would be the best practice when communicating with a client who speaks a different language. Options 1 and 2 are inappropriate and are ineffective ways in which to communicate. Option 4 is inappropriate because it violates privacy and does not ensure correct translation. Question 3. A nurse educator is providing in-service education to the nursing staff regarding transcultural nursing care. A staff member asks the nurse educator to describe the concept of acculturation. Which of the following is the appropriate response? A. It is a subjective perspective of the person's heritage and a sense of belonging to a group. B. It is a process of learning a different culture to adapt to a new or changing environment. C. It is a group of individuals in a society who are culturally distinct and have a unique identity. D. It is a group that shares some of the characteristics of the larger population group of which it is a part. Correct answer. B. Acculturation is a process of learning a different culture to adapt to a new or changing environment. Option 1 describes ethnic identity. Option 3 describes an ethnic group. Option 4 describes a subculture. Question 4. A nurse is providing discharge instructions to a Chinese-American client regarding prescribed dietary modifications. During the teaching session, the client continuously turns away from the nurse. The nurse should implement which appropriate action? A. Continue with the instructions, verifying client understanding. B. Walk around the client so that the nurse constantly faces the client. C. Give the client a dietary booklet and return later to continue with the instructions. D. Tell the client about the importance of the instructions for the maintenance of health care. Correct answer. A. Most Chinese Americans maintain a formal distance with others, which is a form of respect. Many Chinese Americans are uncomfortable with face-to-face communications, especially when eye contact is direct. If the client turns away from the nurse during a conversation, the most appropriate action is to continue with the conversation. Walking around to the client so that the nurse faces the client is in direct conflict with the cultural practice. The client may consider it a rude gesture if the nurse returns later to continue with the explanation. Telling the client about the importance of the instructions for the maintenance of health care may be viewed as degrading. Question 5. A nurse educator asks a student to list the 5 categories of complementary and alternative medicine, CAM, developed by the National Center for Complementary and Alternative Medicine, NCCAM. Which of the following, if stated by the nursing student, would indicate an understanding of the 5 categories of CAM? A. Herbology, hydrotherapy, acupuncture, nutrition, and chiropractic care. B. Mind-body medicine, traditional Chinese medicine, homeopathy, naturopathy, and healing touch. C. Biologically based practices, body-based practices, magnetic therapy, massage therapy, and aromatherapy. D. Whole medical systems, mind-body medicine, biologically based practices, manipulative and body-based practices, and energy medicine. Correct answer. D. The 5 categories of complementary and alternative medicine, CAM, include whole medical systems, mind-body medicine, biologically based practices, manipulative and body-based practices, and energy medicine. The other options contain therapies within each category of CAM. Question 6. Which of the following clients has the lowest risk of obesity and diabetes mellitus? A. A 45-year-old Native American man. B. A 23-year-old Asian American woman. C. A 35-year-old Hispanic American man. D. A 40-year-old African American woman. Correct answer. B. Rationale: from the options provided, Asian Americans have the lowest risk of obesity and diabetes mellitus. Because of their health and dietary practices, Native Americans, African Americans, and Hispanic Americans have a high risk of obesity and diabetes mellitus. Question 7. A nurse is preparing a plan of care for a client who is a Jehovah's Witness. The client has been told that surgery is necessary. The nurse considers the client's religious preferences in developing the plan of care and documents that A. Religious sacraments are important. B. Medication administration is not allowed. C. Surgery is prohibited in this religious group. D. The administration of blood and blood products is forbidden. Correct answer. D. Among Jehovah's Witnesses, surgery is not prohibited, but the administration of blood and blood products is forbidden. This religious group does not believe in sacraments. Administration of medication is an acceptable practice except if the medication is derived from blood products. Question 8. Which of the following meal trays would be appropriate for a nurse to deliver to a client of Orthodox Judaism faith who follows a kosher diet? A. Pork roast, rice, vegetables, mixed fruit, milk. B. Crab salad on a croissant, vegetables with dip, potato salad, milk. C. Sweet and sour chicken with rice and vegetables, mixed fruit, juice. D. Fettuccine Alfredo with shrimp and vegetables, salad, mixed fruit, iced tea. Correct answer. C. Orthodox Judaism believers adhere to dietary kosher laws. In this religion, the dairy-meat combination is unacceptable. Only fish that have scales and fins are allowed. Meats that are allowed include animals that are vegetable eaters, cloven-hoofed, and ritually slaughtered. Question 9. An Asian American client is experiencing a fever. A nurse recognizes that the client is likely to self-treat the disorder with A. Magnetic therapy. B. Intercessory prayer. C. Foods considered to be yin. D. Foods considered to be yang. Correct answer. C. In the Asian American culture, Health is believed to be a state of physical and spiritual harmony with nature and a balance between positive and negative energy forces, yin and yang. Yin foods are cold and yang foods are hot. Cold foods are eaten when one has a hot illness, fever, and hot foods are eaten when one has a cold illness. Options 1 and 2 are not health practices specifically associated with the Asian American culture or the yin and yang theory. Question 10. The role of a nurse regarding complementary and alternative medicine, CAM, should include A. Advising the client about good versus bad therapies. B. Recommending herbal remedies that the client should use. C. Discouraging the client from using any alternative therapies. D. Educating the client about therapies that he or she is using or is interested in using. Correct answer. D. Complementary, alternative, therapies include a wide variety of treatment modalities that are used in addition to conventional therapy to treat a disease or illness. Educating the client about therapies that he or she uses or is interested in using is the nurse's role. Options 1, 2, and 3 are inappropriate actions for the nurse to take. Question 11. An antihypertensive medication has been prescribed for a client with hypertension. The client tells a clinic nurse that she would like to take an herbal substance to help lower her blood pressure. The nurse should take which appropriate action? A. Tell the client that herbal substances are not safe and should never be used. B. Encourage the client to discuss the use of an herbal substance with the physician. C. Teach the client how to take her blood pressure so that it can be monitored closely. D. Tell the client that if she takes the herbal substance she will need to have her blood pressure checked frequently. Correct answer. B. Although herbal substances may have some beneficial effects, not all herbs are safe to use. Clients who are being treated with conventional medication therapy should be encouraged to avoid herbal substances with similar pharmacological effects because the combination may lead to an excessive reaction or to unknown interaction effects. The nurse would advise the client to discuss the use of the herbal substance with the physician. Options 1, 3, and 4 are inappropriate nursing actions. Question 12. A nurse describes low-risk therapies to a client and includes which of the following in the discussion? Select all that apply. 1. Herbs. 2. Prayer. 3. Touch. 4. Massage. 5. Relaxation. 6. Acupuncture. Correct answer. 2, 3, 4, 5. Low-risk therapies are therapies that have no adverse effects and, when implementing care, can be used by a nurse who has training and experience in their use. Low-risk therapies include meditation, relaxation techniques, imagery, music therapy, massage, touch, laughter, and humor, and spiritual measures, such as prayer. The other options are not considered low-risk therapies.